Okay, let's see if we can get this YouTube thing going here. Here's a link for you guys. Let's see if that gets you there. And we'll back up here. Hopefully this will work for you. So at any rate, what I was saying, we'll go through the Facebook group and see if we can get this going for you. So, and Noelle's asking about coconut oil. And so coconut oil, you know, was like the biggest thing ever as far as it was the most impressive health food and blah, 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 blah. And now people are saying it's awful and bad for dogs. And so some, you know, as always, somewhere, oh, for Pete's sake, somewhere along the line is the truth. And what that means is, let's see, get shareable link, let's try that. That should work. Good. So I'll keep us streaming. Apologies, I obviously hadn't quite figured out everything, so I'm trying to make sure that you all are the only ones that have access to this info, because you're the, you know, it's personal questions and all that good stuff. So hopefully that link should work. It looks like it will. So at any rate, with coconut oil, you know, so there's somewhere in the middle is the truth. Is it that all coconut oil is evil incarnate? Is it that, you know, it's the best thing in the universe? And the answer is kind of twofold. One is you have to see if your pet does well on it. And the second is I really do recommend rotating the oils. So, you know, again, one batch coconut oil, one batch you know, grapeseed oil, avocado oil, olive oil, all of that. And if your pet has had pancreatitis, it may be a good option to leave out. There is an association between using coconut oil consistently and pancreatitis. And hopefully what will happen is, you know, you just use it every third batch and everything is good and it doesn't create issues. But if your pet has had pancreatitis to the point where he or she had to go in the hospital, then I think it's definitely something to leave out. The other thing is if you're not sure, is watch. You know, if you have a batch where you know, you notice that your pet's stomach is more gurgly, then it's probably not a good thing. So kind of keep track of that. It's, you know, like your food journaling for your pup. So we, you know, hopefully that makes a bit more sense. All oils I do recommend adding after the food is cooked and it has cooled down somewhat. And my thought is that there are good properties in those oils, but when we cook them, we take away some of them. So I hope that's helpful, and Noel. Patina, I love this picture of Mr. Bear. He's very handsome and he likes his sofa. And Heather loved Chance, and I can't remember your young lady's name, but they're like, can we have it now? Can we have it now? So I love that. Sita's asking about using Instapot, and I think it's perfectly fine to use. The calcium citrate you do want in each batch of food because that's going to do a couple of things. One is certainly balance out the calcium and phosphorus ratio to make it proper. And then the other thing is it helps to get rid of the stuff, the phytonutrients in the beans, or the anti-nutrients, I should say, in beans and brassica species. And that will help tremendously as far as getting those things to settle out. The heat itself is not going to damage the citrate, the calcium, so definitely use it that way. It's great that you've got an Instapot, and again, if it's doing making life easy for you, rock on. Keep doing it that way. And April, I love this picture. Sounds like he's getting his nose all warm. Looks like he's getting his nose all warmed up. And there's a beautiful picture of Mary, who thankfully is going well still, I believe, Bettina, that you've had no further problems as far as the that nasty tumor that you had. So hopefully this is working a bit better. Jamie, beautiful batch of food. And, you know, again, with spinach and leafy greens, you can always double down on those because they kind of cook away to nothing. But beautiful batch. And then April's asking about what to do to bulk up the recipe if your pup's having a reaction to grains. And you got a lot of great answers. So, Kathy, I don't think flax is something that's typically really difficult to for dogs to digest. Chia seeds actually are not a bad option because they are a fairly high protein grain. They are a ton of fiber though, so you're going to have to watch for gas and things of that nature. But I think what April is asking is how does she add more calories in? And so there's kind of two ways. You can try using sweet potatoes or other ones that are off of the list of things that Thor may be reacting to. So sweet potatoes, and then you can also use things like the orange-fleshed winter squashes, butternut squash, acorn squash, things of that nature. So that's always a good idea. And so go for that, and you guys are all talking about what you're rotating through. Miyoshi, I think you got this squared away as far as getting an order in. I saw an order that you had placed. If you're still wanting something else, just email me, Dr. Ruth Roberts at drruthroberts.com, and I will get that order in for you. That's always the best way to reach us. So, Miyoshi, if there's something you wanted, let me see if it says it in the... Yeah, and I'm sorry, it's frustrating, and I'm trying my best to fix it. So let me know what you wanted, what you think the price should have been, Miyoshi, and I'll be happy to make it right for you. April, this looks awesome. And that's great that you wrote down kind of what you're using there. And let me know how that did or didn't work for you. It looks like, everybody's talking about getting a freezer and getting a big roaster pan. So, and it's wonderful. I mean, you can use these big roaster ovens, and then you can also get the hotel pans that will actually fit into the oven. And the hotel pans, the 6-inch deep ones, will hold 3 batches of CrockPet diet. And let's see. Leanne is asking, I think we got to talk about this a little bit, but yes, your pet's kidneys got damaged by meloxicam, and the creatinine is not normal, but it's down to pretty close to normal. So the kidney protein drop is about 2 rather than 3 pounds of protein, and that brings it down to be consistent with what's in the prescription diets. But Leanne, frankly, I think by feeding cooked food, and I love your comment here that you got told by the vet she had a month to live and sent out with canned prescription food. And that's just insane with this creatinine at 2.3. So I would bump it up. You can add more grains, more fat to add more calories to the diet. And then the other thing I would do is add in quercetin. That has been one of the biggest home run supplements for kidney disease, and it works by decreasing the deposition of advanced glycosylation end products, which are the things that create the scarring on the kidneys. And then the other thing I would do is add in a really high dose of fish oil and probiotics to help assist with the kidney function. And Jan's asking about holistic total body support. I am happy to tell you that it will be available in about 10 to 12 weeks. I still have some left. Again, it is expiring at the end of January. You know, I'm going to have to pull it off sale pretty shortly because I can't continue to sell it past its expiration date. But generally, 6 months, 4 to 6 months past the expiration date, everything is pretty good to go. The other upside is I've been able to reformulate this so it will accommodate both dogs and cats. So for you dog folks out there, it will have additional taurine in there, which I think will help prevent some of these issues. So we'll have that available. You should be able to have enough on hand to get you through to that period of time. So we're looking at mid to end February for that to be available. So again, it's priced right now at $8 a jar. If you want to order a bunch of them, just again email us, let me know how many you'd like, and I'll make you a deal on it. If you don't mind the 10-day delay in shipping, then this should come out, this should work out pretty nicely for you. And Sabine, I love this video. Too much brassicas or God knows what else. Mostly probably this pup's eating Purina dog chow though, right? And I think that's got all the questions answered for this week. Hopefully this has worked okay on YouTube. Let's see. Oh, and that's the other thing I did want to mention to you too. We've been, a lot of you have expressed difficulty with, the consult packages. It's a lot of work, that kind of thing. And many of you already have the original CrockPet diet, so it's not so much of a boon for you from starting from zero. So what I've offered here is a consultation a la carte, and I'll put that here in the comments. And that should show up for you all. The way this would work is you basically fill out a form, and we get a call scheduled, and that can be either via Zoom video chat. I did one with Kathy via WhatsApp, so that will be a little bit easier for you. I'll make a call recording, and then anything you want to discuss during the call as far as labs, things of that nature, just drop them in the either email and I can pull them up and we can go over them together. If you want to use this as a kind of a pre-planning, then that's another way as well. So I hope that makes sense. Sorry this has been a little bit difficult with the YouTube, but hopefully I've got it set up so that next time it won't be so hard. So until next week, remember, your pet's best health starts in the bowl. Thank you and take care. Talk soon.